All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the monthly finance meeting on June 23rd, 2020. Minutes of the special finance meeting on July 13th, 2020. Minutes of the special finance meeting on July 20th, 2020. And minutes of the special trustee meeting June 23rd, 2020. Along with the check report June 9th, 2020 through July 8th of 2020.
I move we approve the consent agenda as presented, items A through E.
Second.
I have a motion by Dr. Brown, a second by Dr. Hannaford to approve the consent agenda as it was presented. Roll call vote, please.
Gaspard,
Yes.
Hannaford,
Yes.
Lawrence,
Yes.
Randalls,
Yes.
Brown.
Yes.
All right, next item is the CEO's report. Candace.
All right, as you can see through my report, regarding Dr. Galbraith's office, he is up and running, and I think the last time I checked, he had 10 or 11 patients for today, so that's a good number. Just starting out, it takes some time to build, but we're excited to get him on board, and have heard good things about him from the community. Everything I hear is everybody says he's so nice, so that's good to hear. We are going through a new process with Paycom regarding onboarding of employees. If you'll remember, that was one of the things that we needed to improve on when we did the self-survey, was improve the onboarding process. One of those things that we're working on right now is, actually Chris was the first one to go through it today with the background check. So that worked well, and we look forward to getting all of our onboarding process online for ease for the employees as well as for us. The TrueBridge project is ongoing. We continue to work with Suhaila with Meditech reports being requested by TrueBridge. We're working through those processes, and we're getting there, I would say. We knew that it would be a little bumpy and it would take quite a bit of time, but overall it's going well, and I think it was a good decision. So, server room project, you can see Mark's notes on that. The VersaBadge project is ready to kick off. The providers, being Dr. Lawrence, Emily, and Dr. Hicks in the ER will wear sensors. News to you, I know, probably. So they'll wear sensors. This is to help with our reimbursement with the provider downtime in ER. We only got a portion of that on the last cost report, and it brought us over $840,000 if I remember correctly.
Right.
So we decided to buy software that would help us calculate that to the minute, and so we're excited about that. The providers will wear a sensor, and when they enter the room, it will report out on, because you can't get paid for the physician's time when they're in the room with the patient, because you're being paid for that with the coding of that the ER visits. So in the downtime of the physician, Medicare reimburses for that. So we're excited to get that project rolling.
Yeah, and just to tag on to that, so imagine if that was in place during this whole COVID deal.
Yeah.
Because this is actually to prove, in a weird way, how much they're not doing.
Loss.
So that we get more money back.
Yes.
As compared to, because if they are, I mean, if they had 600 visits this month, we're going to get our money that way. But during COVID, where you had
A lot of downtime.
a lot of downtime, we would have got a lot of reimbursement because that cost is still there to keep.
So what we submitted on the last cost report, all we could prove was the patient admit and discharge time. So we gave the assumption that the physician was with the patient the entire admit and discharge time, not a portion of it, the entire time, and we got that much money. So this should be a
Is this just reimbursement from COVID money or?
No.
This is part of our critical access.
Okay.
Yeah.
So for example, if they were in the ER for 2 hours, but the doctor was only physically with them for 15 minutes because they had lab work that they went and did, or a nurse had been in there or whatever, before that was an hour and 45 minutes we weren't being reimbursed for.
And so my understanding too is anything I do out of the room when I sit down to call consultants, do paperwork, do the chart, whatever, as long as I'm not in the room with the patient, we're being reimbursed for that, even though I'm still working on that case, but that time doesn't count, so.
So that's exciting.
Mhm.
We've been pretty busy on the floor. We were running around 6 patients or so. This morning we were down to 1, and it's been pretty busy. We've had the LPN students from the college, or from the Northwest Tech, have been back doing their clinicals, so it's good to get them back in here. We'll be working closely with Northwestern, and trying to do a better job recruiting those nursing students early on before they make decisions. So I've had some conversations with Leslie and hope to improve our relationship there. I do have 2 exciting things to announce. One being Chris Lauderdale is here with us this evening. Chris has accepted the CFO position and will start Monday with us. We're excited to have Chris. Chris has been at Northwestern as a comptroller for the past 7 years or so. And Steve is going to stay on and help train Chris. And Steve will be mostly working with the COVID project going forward once he gets Chris trained in. So we appreciate Steve staying on and helping Chris get acclimated to the healthcare environment. So welcome, Chris. We're excited to have you.
Appreciate it. Welcome.
The next one that we hired is David Camp, has accepted our HR position. And David will join us September 1st. He is currently an associate pastor at Emmanuel Baptist in Enid. Prior to that, he was St. Mary's HR director, and he took a little time off from that for personal reasons. But he's worked in critical access hospitals before, a long career in healthcare, very strong leadership skills, and I was literally blown away when I was kidding him. Mark Nichols sat down and interviewed him with me because he knew Mark from St. Mary's. And so we gave him the whole dog and pony show tour and sat down, and I looked at him and I said, okay, so when do you start? And then I just started giggling because I really didn't think there was any way this guy was going to come to work for us. And he answered me. He's like, well, how does September 1st sound? And I almost passed out. Oh, I was so excited. So really looking forward to David starting. He's going to help us get a couple of really big projects that have been on our plate for a long time. We just didn't have the resources to pull them off. One is getting our policy and procedures updated and online, improving our onboarding process, working on our wage matrix, several big things, and working on culture is huge. So employee retention, I got a whole long list for him. So anyway, that's all I have. Do you guys have any questions for me? All right, thank you.
If there's no questions for Candace, I would entertain a motion.
Make a motion to approve and accept the Shared Medical Center written report.
Second. Give it to the doctor.
Okay. I have a motion by Dr. Hannaford, a second by Dr. Brown, to approve the Shared Medical Center written report for July 28th, 2020. Roll call vote, please.
Hannaford,
Yes.
Lawrence,
Yes.
Randalls,
Yes.
Brown,
Yes.
Gasper.
Yes. Candace, thank you. All right.
If I'm hot, I know you got it.
Next item is the CFO's report. Steve-O.
If you'll turn back to the tab that says Cfo Board Report on it, after that tab are the hospital financial statements for the period ending June 30th, 2020. And if you'll turn to the third page, we'll go over some of that information with you. This this isn't O'Hare Medical Center, it's still Share Medical Center. I don't know what happened there. I can only blame myself, so. Operating cash balance at the end of June was $486,000, a little less than 20 days of operating expenses. Our accounts receivable balance, $4,572,000. That was an increase of almost $500,000 in the month of June. Accounts payable was a little under $319,000. That's considerably less than it has been for months. We've gotten accounts payable down to where it's very manageable. I hope we can keep it there. Gross patient revenue for the month was an increase of about $205,000 to $1,465,000. Our volumes, total patient days in the hospital for June were 110 compared to 89 in May, and total clinic visits for June were 1,204 compared to 873 in May. So we're starting to get busier. People are starting to come back into the hospital. Contractuals amounted to right at 50% of gross patient revenue. So we all know by now that that means that we only collect, or only hope to collect, about half of what we bill. And that's before all of our expenses and things like bad debt write-off and charity care and things like that. So actually charity care is included in that. So we stand to only get about half of what we bill. Accounts written off at collection agency, 8,476 in June. Charity care was 12,556. Our operating expenses actually decreased $10,000 compared to the prior month. Salaries and wages, $375,000, which was a decrease of about $46,000 compared to the prior month. And you'll notice here that the hospital had a net operating income for June of $718,000. That looks really odd, doesn't it? We rarely have a net profit. Dr. Hannaford already picked up on this, and I'm sure some of the rest of you have too. If you turn to the next page, there's a 6-month comparison of income statements for the last 6 months. And like I said, just about every month we had a sizable loss. In June we had a sizable net income. The reason for that, pass something out here that I think you'll find interesting, and Jay, let me get you. And what I just passed out is how we're using the stimulus funds that we've gotten from Health and Human Services. First part shows how they were paid in, what programs they came from. The next part shows the usage of how we're going to use those funds, how we're going to try to keep those funds. We're going to recognize revenue that's been lost starting in February coming through June. And then we have expenses we've paid each week starting the first part of March through the end of June that are related to COVID-19. And then we have a couple capital expenditures. We had to reduce all of that by some normal usage of our personal protective equipment that we would have had without COVID. So what this says is, down there at the bottom, total use of funds, $765,282.10. That's the amount of revenue that I recognized at the end of June for the end of that fiscal year. So we're able, up to this point, to keep $765,000 of that stimulus money, put it back into our operating fund to pay for expenses and help compensate, help make up for that loss of revenue. So We'll be putting that back into the general fund. That's gonna help a bunch coming up because as we know, Medicare advanced us a considerable amount of money. They made it, basically prepaid the Medicare we're gonna be getting for some time as a loan up front back when COVID first hit to help keep the hospital open, help with cash flow. Well, now we're gonna have to start paying that back. They're gonna keep our Medicare money going forwards for a while. So this will definitely help pay wages, that sort of thing. So that's shown on the balance sheet. There's some other operating revenue in there with it, but that figure of $888,018 includes this $765,000. So that's why we showed a profit for last month. The next sheet in your book is a breakdown of other expenses. We always look at that just because the total of them is a pretty significant amount of money, but nothing out of the ordinary in any of those for this last month. And then the next sheet is a 2-year comparison between fiscal year in 2019 and fiscal year ending June 30th of 2020. Cash flow statement on the next page, I'm not going to spend any time on. Accounts receivable, next couple pages, if you have any questions about any of those. And then there's a balance sheet there at the end, 2 pages. Can I answer any questions about any of that? I know I throw a lot at you real quick.
Even if we didn't use those funds, we still would have been a little bit ahead for the month, correct?
Well, it would have been, yes, we would have. Yes.
Which is a positive.
Right. Yeah, our revenue's coming back. I mean, it's definitely, June was a pretty good month.
But you can see, if you look at year-to-year comparison there on page 4, when you try to get an idea of what happened because of COVID and the difference of gross patient revenue and how much was billed, that billed difference from one year to the next, and most of that's going to be because of how COVID hit us.
Let's go over to the tab for convalescent home. We'll look at those financials. Again, on the 3rd page, some statistics. Cash balance over there was just under $300,000. That's about 33 days of operating expenses. Accounts receivable, $542,000, was down $33,000 for the month. Accounts payable balance, $26,773, 8.6 days of operating expenses. That's really good when you get the number of days of expenses you have in accounts payable is low like that. So Kelly's worked really hard at the nursing home and his staff and have turned things around over there to where they're showing maybe not every month a profit, but doing a lot better over there. Gross patient revenue was $252,000 for the month, which was down some. I think that was mainly a timing difference. We don't have contractuals over there because Medicaid's actually reimbursing at the same rate as what we charge. Operating expenses without salaries, benefits, and depreciation, $83,687. That was down $10,000 from the prior month. Salaries and wages were down about $1,900. Nursing home showed a sizable profit, and if you look on the next page, there's a 6-month comparison. You can see that this month's profit was considerably higher than it had been in prior months or showing losses in prior months. Again, on that handout that I gave you, the 2nd page is the nursing home activity as far as use of the COVID funding that we're getting. We've gotten the money from Health and Human Services We've shown loss of revenue of about $168,000 for that 5-month period ending in June. Had operating expenses of about $21,000, so you add all that up, we're gonna be reimbursed, we're gonna reimburse ourselves out of that stimulus money, $189,000, and put that back in the operating fund of the nursing home, so that's gonna help the nursing home considerably. Last one, let's look at, do you have any questions about any of that? Skipped over it all pretty quick. Let's look at the homestead, this is the next tab. No stimulus money here, but the homestead tends to show a profit usually. We've had losses at times, but we showed a pretty sizable profit of $29,000 in the month of June. And 2-year comparison there on the next page. Any questions about any of that? The next item, it's a time of year that we have an audit done for this year that just ended on June 30th. BKD has done that audit for several years now. They have sent us an engagement letter for the audit for this last year, and I'm asking you to authorize the CEO and CFO to sign and execute that engagement letter with BKD so they can perform an audit, financial audit of Share Medical Center for the year just ended June 30th.
I move we authorize the CEO, CFO to sign and execute the engagement letter for BKD, CPAs and advisors of Tulsa, Oklahoma to perform the audit of Share Medical Center for the fiscal year ending June 30th, 2020.
Second.
We have a motion by Jay Randalls, a second by Dr. Hannaford, to authorize the CEO and CFO to sign and execute an engagement letter with BKD, CPAs, and advisors of Tulsa, Oklahoma, to perform an audit of Share Medical Center for the fiscal year ended June 30th, 2020. Roll call vote, please.
Lawrence,
Yes.
Randalls,
Yes.
Brown,
Yes.
Casper,
Yes.
Hannaford.
Yes.
And the last item, I'm asking you to approve instructing the 3 banks in town, Alva State Bank, Bank Central, Community Bank, to allow our new CFO, Chris Lauderdale, to receive any and all financial information and to conduct financial transactions on behalf of Alva Hospital Authority. As I train him, I'll be turning more and more over to him, so he needs to be able to access those records going forward.
I move we approve instructing Community Bank, Alva State Bank, and Bank Central to allow Chris Lauderdale, our new financial officer, to receive all financial information from that financial business for the hospital.
Second.
I have a motion by Jay Randalls, second by Dr. Brown, for the approval of instructing Alva State Bank, Bank Central, Community Bank, to allow Chris Lauderdale as Chief Financial Officer to receive any and all financial information and to conduct financial transactions on behalf of Alva Hospital Authority. Roll call vote, please.
Randalls.
Yes.
Brown,
Yes.
Casper,
Yes.
Hannaford,
Yes.
Lawrence.
Yes.
I don't think you repeated that motion.
That's all I have, Mr. Chairman.
All right. Thank you, Steve-O. And I will tell you, between COVID, between PPP, between audit, and everything else, it's been pretty overwhelming. But hey, you came through, and the numbers look positive.
Yeah.
Initiation by fire.
Yeah, it's,
That's how we do it
I
around.
mean,
Oh, sorry, Chris.
I don't know, back in March when COVID was really cranking, I was starting to wonder how we were going to get through this. But you know, it's gone pretty well so far. I I gotta hand it to the federal government, they've really stepped up. And whether you like the politics or not that go on, I think they saved this country, because otherwise, I don't know what would have happened. You know, lots of hospitals, even big hospitals, would have been gone by now. And that's a scary thought to me, especially in a big city when you have a huge hospital that's teetering on the brink of going out of business. That would be a terrible situation, so I applaud them for doing that.
Well, and I'll piggyback on that just a little bit. Through all this, there were many institutions, medical institutions that either furloughed folks, laid people off, or took pay cuts or something of that nature, and we didn't have to do any of those. And so kudos to our staff for making cuts where they can make cuts. Kudos to the administration for leading us through this, so thank you guys.
And I really think with the help of the COVID funds and everything else we've done, knock on Formica, but I don't see us having to do any of that going forward in the immediate future either. So I think we're in good shape. We really are. The thought of them taking all the Medicare funds is kind of scary, but we can get through it. We're well poised to get through that.
All right, well, thank you very much.
Yeah.
Next item is Medical Staff Executive Committee, Chief of Staff, Dr. Lawrence.
All right. Yeah, the medical staff met on July 9th for our monthly medical staff meeting. We had a good turnout. We approved the minutes from the previous month's medical staff meeting. There was no old business to discuss. The only pertinent new business was we put a protocol in place to allow outpatient COVID testing without a doctor or a prescriber's order. So now that we have enough raw materials to go around, people in the community who want to get tested, have hopefully a little bit easier vehicle to just come in and get that done without one more roadblock in the way. We approve that.
Thank you, that worked well for us, thank you very much.
Did it really?
It did.
Okay,
Absolutely.
good.
Good.
I always worry about glitches when these things take off, so neat. We made an appointment for Dr. Galbraith to staff. That was approved, of course. As far as quality and improvement for patient care, I see those accounted for on tonight's agenda a little below me, so I'll just jump to the last thing. We had discussed a change made to the specific type of lab testing we do called vancomycin peak and trough. That was an in-house lab. It was something that we farmed out a couple of months ago, just under the assumption that was going to be a good financial move. And it seems to not be. From the early reports, it's hindering Dr. Rader and our inpatient docs and some of our referring providers and being able to get timely results on a lab they need. I think when we made that change, the annual savings was projected to be something like $2,000 to the hospital. So literally losing a single test or two, or single referral or two probably offsets that. So I believe we discussed doing an internal study to see if it was worth bringing that back in-house for cost efficiency. It's a test I don't do a lot of in the ER, so I don't have a really valid opinion on it other than the people that use it in matter say, hey, it's not working as well. We may have to do some of our work elsewhere because of that. So, we discussed in the hospital restraint processes, and as far as items unique to the med staff meeting, that was the brunt of it right there. And do you guys want to go over QAPI and all this as well?
Yes, we can, but let's first, we need to do the credentialing and the appointment to active staff, Bryce Galbraith, DO.
Make a motion that we appoint Bryce Galbraith, DO, to the active staff.
Second.
We have a motion by Dr. Brown, a second by Dr. Hannaford to appoint to active staff Bryce Galbraith, DO. Roll call vote, please.
Brown,
Yes.
Gasper,
Yes.
Hannaford,
Yes.
Lawrence,
Yes.
Randalls.
Yes.
Okay, cool. All right, so yes, now move to, if we can, I guess, to QAPI. The only thing that we will have in here, I believe, other than what you have from your QAPI meeting, is the validation of calendar for any contracts or policy reviews. And those all look to be compliant and were reviewed, so those are all good. But from your Quappy meeting,
And I actually was not present at that meeting, Candace, were
I
you?
can go ahead and go over it. No code strokes in the month of June, 3 suicide charts were reviewed, 10 contracts, no grievances, patient grievances for the month of June, no employee injuries. We did have 1 patient safety issue, no medication errors, and 3 new employees were hired for the month of June.
okay,
All contracts were compliant and approved, and that's about it.
all right. So continuing under improvement to patient care, there are 6 policies that were reviewed. Item B is med staff bylaws. Item C is 340B policy. D is the dietary policies. E is the emergency room policies. F is the nursing policies. G is the physical therapy policies. My first question would be is, was there any recommended changes to any of those?
No.
Okay, so seeing that there are no changes, all of these items, 7B through 7G, are routine policies and procedures. They can be approved by 1 vote unless any trustee desires to have a separate vote on any or all of those items. Does anybody want a separate vote on any or all those items? If not, I would entertain a motion to approve those policies and procedures, 7B through 7G.
Make a motion to approve the following items from 7B to 7G listed on the agenda item under improvement to patient care.
Second.
Is that Dr. Lawrence? Okay, I have a motion by Dr. Hannaford, a second by Dr. Lawrence for the approval of items 7B through 7G listed under improvement to patient care. Roll call vote, please.
Casper,
Yes.
Hannaford,
Yes.
Lawrence,
Yes.
Randalls,
Yes.
Graham.
Yes.
All right, cool. Thank you, guys. Dr. Lawrence, thank you as well.
You're welcome.
Next item is the Sheriff Convalescent Home Report. Do we have anything to report?
No, it's in your packet. I don't have anything special. He didn't mention anything.
Okay.
I do think it's interesting if you'll turn to the last couple of pages, so on the nurse call system, if you'll remember, they got a new nurse call system, and they have been working really hard on their response times. In June alone, they had 5,330 call light push responses. Their average response time was 3 minutes and 58 seconds. So 68% of their calls were 5 minutes or less. I think that's incredible. That is commendable.
5,300.
Can you imagine how many steps that involves? Holy moly. So very proud. Kelly, I can't tell you how pleased I am, how proud of Kelly I am. He is doing an amazing job. He has taken that and embraced it, and he works his tail off, and it shows.
They also had no deficiencies on their survey for
For
COVID.
COVID, no. They did a special survey to make sure that they're doing the right things to keep COVID out, and they didn't have any deficiencies on survey.
So one of the things with the COVID money that you're able to do is go back and recoup monies that is lost revenue. Both of the nursing home is able to do it on theirs, and so is the hospital. So at this moment, one of the things that we're trying to do is bank as much of that back as we can so that we can then work on, first take care of that lost revenue. If there's areas that need that money, we can do that. But also to be able to take care of some other stuff that just needs to be able to be taken care of before we just make purchases to be making purchases. And so and Steve here have diligently been working to work on that. Steve gave that report of the almost 800,000 here just so far. We get to be able to do that month after month after month, as long as we're in the COVID state. So there will probably be some things that we'll be able to hopefully get taken care of with that as well.
One thing I do want to mention, as you remember, Christy Mormon left in July to accept another position at a nursing home in Miami, and we made the decision to use Tanya Escobar, that is a nursing home employee. She helps Kelly with the books over there. And then Carla Hess, who was Christy's administrative secretary at the nursing home, or at the homestead. Between the two, on a daily basis, working together, they are taking over Christy's duties, and Kelly is meeting with then Carla on a weekly basis, or more frequently, to help her with the homestead. And so we're going to see how that goes. Carla's very capable of handling those processes, and so we're going to see how that goes. And I think she's doing a great job.
Anything else? We might just remember the family of Chris Parkhurst. Chris was a long-term employee over there at Shared Convalescent Home until she had to retire because of health issues, and she just recently passed away here this last week. And so, both for the employees over there that worked with Chris for so long, but also her family, to keep them for many years. For those of you that have been on the board for very long, Chris was the one that prepared the meal that we had here, and so she will be missed. Next item is the homestead report. Outside of what you've already reported, is there anything there? Okay. Any questions about the Convalescent Home or the homestead from anybody? If not, we'll move forward. We will skip foundation report and St. Anthony's report. We'll move to the city council report.
Not a lot to report, as you, I'm sure, know. Our sales tax was down slightly for the month. We did meet with our treasurer beforehand. Reinvested all 4 CDs that came up, and then really the rest of the meeting, we had some buildings for declaration of dilapidation that we reviewed, and then approved an agreement for a resource officer between the city and the Northwest Technology Center. And that was really about it, so pretty short meeting.
Any questions for Bo in regards to that? If not, I don't have anything to report under the chairman's report. However, we do have a new item of new business. Something we've talked about for a while is something that needed to be replaced was the CT machine. And this came up, we just got the lease agreement today, and so that's why it's falling under new business instead of a regular item. Our current CT scanner is on its last leg. In fact, they can't get pieces of equipment to replace those that are going to need to be replaced. It's paid off. We've had that piece of equipment since, we believe, 2007. But we spend over $8,000 a month just on the maintenance agreement. So keep that in mind as we go into this new lease agreement. We're spending a little over $8,000 a month just on the maintenance agreement right now for the old dilapidated machine. Okay?
And it goes down how often? Frequently?
At least once a week.
Yeah,
Right
at
now,
least once
at
a week.
least.
So this new machine, and we got a couple different bids. One was from Siemens, one was from Canon, which is what is in front of you. The other thing that we have to keep in mind is on these CT machines is them also being able to get into our room without having to do any major construction. The Siemens machine was no guarantee that they could get that into the room. It was going to be a 16 slice machine. It was less expensive on the purchase, but not necessarily on the maintenance agreement. This machine is the one that they would like to purchase, and it's from Canon. It will be a 32 slice. So you're getting a 32 slice compared to a 16 slice. If we were to purchase it outright, it was $395,000. Your maintenance agreement is separate. It comes with a 2-year warranty. So for the first 2 years, we won't have this maintenance payment or maintenance agreement, service agreement. But in years 3 through 6, you will have that service agreement. And that is an additional $4,213 a month. Now, mind you, we're currently paying over $8,000 a month for the current service agreement. We talked in finance about checking into a lease, and the lease agreement for this machine would be, Steve, that's just $5,878.
That's right, yes.
Okay.
That is the lease of the equipment. It's a fair market value lease, so at the end of 6 years, we would have the option of buying that piece of equipment at its fair market value at that time, which is probably about 10% of the original cost. But for 72 months, we'd make a payment of $5,878 on the equipment itself. And that's a total of
423, 216.
I guess I didn't actually come up with that figure. Is that what you had?
$423,216.
So not a whole lot more to lease it than it would be to purchase it. Of course, at the end of the lease, we won't own that piece of equipment, but with most medical equipment and stuff that has a lot of electronics in it, after 6 years of use, you probably don't want to own it. It's probably going to be outdated by then and problematic like the one we have now is. So this one we have now is, I think, 14 years old.
13 and 14, and that's what we did with it. We did purchase it out after the end of a lease and continued on.
Yeah, and continued using it longer than we probably should have, but that's why we owned it, so we kept doing it. Probably what you're looking at with this is kind of like the server project with electronic health records. You're just going to be making a monthly rental payment from now on, and we just need to get that into the budget. The good part about this is we do have sales tax money that we can make this monthly payment with, so that'll be a good use of our sales tax money to buy a new CT scanner.
And there is a picture, it's like the second to last page of kind of what the machine will look. It also will have 3D imaging along with 32 slice, which is something we've not had and not.
So we'll be able to do the cardiac calcium scores, and we'll be able to still do the bone density.
It's the middle machine, they have 3 there, it's the middle and the prime SP machine.
So basically, we're gonna be leasing, after the 2 years, about $10,000 a month, what we're paying $8,000 per month now.
Right. So technically, we'll be saving over $2,000 a month for the next 2 years compared to what we're doing now, and it's not working at the time.
The last payment in this handout kind of breaks that down for you. There's 2 ways we can do this. We can spread that maintenance agreement out over the 6-month period and pay it out at $2,649 a month, plus the $5,878 for the equipment means we'd be making a monthly payment of $85,1849 a month for 72 months, paying about a total of $613,331 for that equipment and the maintenance. Or they let you, because it has a 2-year warranty, they let you delay making payments on the service agreement until it actually kicks in at the start of the 3rd year. If we do this, our monthly payment goes up because we're paying that out in 48 months instead of 72 months. But for the first 44 months, we'd only have the cost of the equipment, the $5,878. Then at the 25th month, that would go up to $9,838.73 a month. There again, if you do the math, it comes out exactly the same. In other words, they're not penalizing us for waiting 2 years to start making payments, which is kind of unusual in a way. But they said they did that intentionally to allow people the flexibility of paying how they want to. So I would probably recommend paying as little as we have to and just waiting 2 years to start making payments on the
And the other thing that's included in this overall price that they're also doing is giving us 2 months for a mobile unit while they're putting our new one, getting our new one in, so that we have something here that's working. So that's included in there for what they were able to do.
There's a page that runs this way in this handout. I might have you look at it.
Well, however long it took.
Over in the included technologies, we just happened to hit the right time. There's about a 2-year window, August and September, to where we can buy this and get, like we talked about, double the amount of slices per, I guess that's per centimeter, 32 slices per centimeter, I think. So it will take 32 pictures basically for every centimeter that it moves instead of 16. So you're going to have twice as many images for whoever's reading those to look at. Potentially would help find things like, I don't know, cancer. I need to quit talking because I don't know what I'm talking. Anyway, we're getting a $50,000 increase in value without having to pay for that. Like Jason said, we'll have a mobile unit here for up to 2 weeks. That's a $23,000 value. We have 2 years of warranty. Some other things there that they talk about, we had to get new injectors, and that was about $50,000. So you can see this thing isn't cheap, and the maintenance is unbelievably low. It is what it is. It's kind of the standard of diagnostic care, along with x-rays, I guess, are still used in MRIs, but CT scans are kind of the standard anymore, and we use them a lot. And it can be a moneymaker. I'm sure that's something we probably ought to look at sometime, as if we actually make money. But I would think we would be making a fair amount of money with that piece of equipment.
We need to,
I can't practice without it.
Yeah, we wouldn't be able to do business without it.
how do we need to make this motion?
Well,
Counselor, could it just be to lease agreement with Canon and let them figure out which option, I guess?
I really think we probably need to specify which
option?
Yeah.
that last page kind of gives you, I kind of outlined the potential motion, I guess. We just have to decide which one of those two we want to do. Yeah, totals are the same. Like I said, if we want to keep our money and make it work for something else for a couple of years, I guess the second one would be the best option.
And it probably would be, especially with our critical access, because
Yeah.
the service agreements are 100%. And so we're gonna need, the further we get down in critical access is the more expenses that we'll need. So that extra $2,000 a month will be more beneficial then than what it is in the first 2 years.
And during this time of COVID, with all the uncertainty there is with
motion to enter into a lease agreement with Canon at 48 months payable for a total of $613,331 for a new CT scan.
Okay, hold on. 72 months for the lease and 48 months for the service agreement.
Okay, 72 months for the lease, 48 months for the service agreement, for a total of $613,331.
Second.
Oh, and I forgot to point out, if you don't mind me interrupting, because we're going to execute the service agreement now and not wait 2 years to do it, they actually give us a 6% discount. So that helps offset some of the cost of the lease, extending it for a period of time. So we got, I think that amounted to about let's see, $2,500 a year for 6 years, so yeah, $15,000 savings, something like that.
All right, so I have a motion by Dr. Hannaford, a second by Jay Randalls, to approve the lease of a Canon Aquilon Lightning CT scanner as outlined in quote number 140.
I'm not. Don't say legend, because it's the other one, it's the prime, the Killian Prime SP.
Yeah.
Sorry. I don't want to do it again.
All right. Prime.
Yeah, I think it is. It's real confusing because they're kind of free with those terms. And you'll see 16, 32, and 40 throughout this.
Prime
It's
SP.
a 32 slide.
SPCT scanner. Okay. So I have a motion by Dr. Hannaford, a second by Jay Randalls, to approve the lease of a Canon Aquilon Prime SPCT scanner as outlined in quote number 140127-2 for 72 months, and a service agreement for the scanner as outlined in quote number 551520-1, subject to a point of purchase discount for 48 months. All total of $613,331. Roll call vote, please.
Hannaford,
Yes.
Lawrence,
Yes.
Randalls,
Yes.
Brown,
Yes.
Casper.
Yes. All right. All right. With nothing else coming before us, we are adjourned. Thank you all very much.